Hi everyone, in this video a quick review of the pediatric systematic approach to care, starting right now. Hi everyone, you know when we're talking about a systematic approach to care, we're talking about a system, a plan. And I really like the word reproducible because it should be the same every single time we apply it to a child. If you were to read one of my trauma reports, the only things that change, the only items that change are the name of the patient, the nature of the event, and my findings. Otherwise, they're all the same. Head equals my findings, neck equals my findings, and so on and so forth. Listen to a doctor dictate sometime. Blah, blah, blah. They're on autopilot because they have a system. And one of the most important reasons we want to have this system is so that we don't forget something. So this takes practice. Watch other people, how they do their assessments. Look at their system. Is their system better? As long as we're hitting everything we need to hit, the system works. Okay, in this system, we start with the ABCs. But in PALS, we're using the Pediatric Assessment Triangle, so A is not airway. It's appearance, then breathing and circulation. So appearance. You're in the ER, mom comes walking in frantic with the kid in her arms, and you look at him, and you're looking at this kid's appearance. What is their color? Are they pale? Are they pink? Are they blue? What is their activity? Are the eyes closed, open? Is the child alert and acting appropriately? So what's the child's appearance? Next, of course, we'll assess their breathing, and then their circulation. So that's the first step. We just do a quick down and dirty appearance, breathing, circulation, and this is kind of from across the room. Next, is the child unconscious, unresponsive? Do we have to go to work right now? So after that, we looked at that appearance to see, is this an emergency? We're going to take the path that is not an emergency. Okay, let's look at that part of the algorithm first. So there's nothing going on with this kid. We're going to assess their breathing again. We're going to watch them like a hawk, and then we're going to continuously reevaluate them. Let's say mom brought them in for something that's already resolved. Okay, they had a seizure. We're going to investigate that. Was it a febrile seizure? What happened before the seizure? And if the kid still looks fine, then we're going to watch them and we're going to evaluate them for a period of time. Now, if the child is in an emergent state, they're not breathing, they're unresponsive, they have no pulse, step one, get some help. Call a code, get some people coming because you cannot manage this event alone. Next, the algorithm kind of makes a distinction. Is this a full code? They're not breathing and they don't have a pulse? Or do they have a pulse and they're not breathing or having trouble breathing, gasping respirations, and this is a respiratory emergency in a child? So that's a distinction. Respiratory emergency, huge, because that often leads to cardiac arrest, right? Respiratory distress leads to respiratory failure, leads to cardiac arrest. Or are they already in a cardiac arrest? If they're in a cardiac arrest, we're going to begin CPR immediately. Rate of 120. A depth 1/3 through the chest. We're going to get pads on them. We're going to evaluate that rhythm. If it's a shockable rhythm, we're going to shock that kid right away. And remember, for kids, a little tip, pounds double pounds. If the first shock of a kid is 2 joules per kilogram, that's the same as their weight in pounds. And I still think that way. So a 40-pound kid, first shock, first defibrillation dose, 40 joules. Double it, 80 joules for subsequent doses. Now, if it's determined that the child has a pulse, some kind of pulse, but they're not breathing adequately, we're immediately going to open that airway and begin to bag valve mask that kid. Start to support their ventilations, and then assess what pulse they have. Any pulse below 60, despite oxygenation and ventilation, they have poor perfusion, begin chest compressions, because that pulse is not enough to perfuse the body. Again, a pulse less than 60, despite oxygenation and ventilation, and this kid looks like crap, begin chest compressions immediately. Now, looking at this algorithm, the systemic approach really helps us to determine what algorithm are we going to be in. Is it going to be a respiratory arrest algorithm? Is it going to be a cardiac arrest algorithm? Is it going to be a wait and see algorithm? So that's really its importance. We're going to systematically evaluate this child and see where are we going from here. Now I want to go down to box 12 because this has primary, secondary, and then more studies. A primary assessment, we're only looking for life threats in a primary assessment. Quick head to toe, not breathing, uncontrolled bleeding, airway issues, that is a life threat, and we need to take care of that immediately. After that is a secondary assessment. The secondary assessment begins with vital signs, then you have your complete sample history, your OPQRST, and then any findings in laboratory, imaging, anything like that. And then we get into this rotation here. For everything we do in medicine, right, we evaluate it. And we say, okay, that's what that thing is. We come up with a plan to treat that thing. Now we have to evaluate the effectiveness of our intervention. Did it work? Did it not work? If it didn't work, we have to reevaluate and come up with a new plan. And the cycle continues. Assess, find the problem, come up with a plan, implement the plan, evaluate the effectiveness of that plan, and the whole thing keeps going round and around until we discharge and bill that patient. This has been just a quick overview hitting the highlights and the important parts of the systemic approach, the systemic repeatable approach to pediatric care. Again, this takes time. This is not an end-all be-all for all situations. It often has to be modified depending on the conditions, but you need to start developing, especially if you're new to this gig, your own systematic approach. So watch others, take notes. I'm Mark, thanks for watching. See you in the next video. Hi everyone, when we're talking about a pediatric systematic approach to care, we're talking about a system, and I really like the word reproducible because it should be done the same way every single time, and this takes practice. And those are my dogs.